You're still watching NC Continental Prime. To health matters now, as Nigeria strives to achieve universal health coverage by 2030, concerns mount over the severe insufficiency of the 2004 budget in addressing the nation's health challenges. The proposed 1.33 trillion naira allocation for healthcare in Nigeria's 2024 fiscal year has sparked criticism for falling short of addressing critical health needs. At just 5% of the total budget, well below the recommended 15%, concerns arise regarding its adequacy to tackle pressing healthcare challenges. Stakeholders lament the persistent failure to meet the 15% target set in 2001, citing consequences like unaffordable healthcare and the ongoing departure of skilled healthcare workers abroad, emphasizing the need for more effective and efficient resource utilization as experts stress better fund pooling mechanisms and increased efficiency to improve healthcare outcomes. To discuss this, we are joined by Dr. Olawale Abodunrin Peters, a medical practitioner and publicity secretary, NMA Lagos State. Thank you so much for your time, Dr. Peters.
Thank you very much. Thank you for having me. Excellent night to you all. Well done for all that you do.
All right, thank you so much. Now, how would you describe the impact of the allocated healthcare budget of 1.33 trillion naira in the 2024 budget on Nigeria's ability to address its pressing healthcare challenges?
Okay, thank you very much for the question. I hope I am audible.
Yes, you are.
So if you ask again and again, for me, it can simply be described as still catastrophic. Permit me to use that word, because of the fact that there are a lot of, pressing needs, pressing challenges as well facing, the healthcare sector. And the government has not deemed it fit, considering, the gathering of the African Union in 2001 to reach a budget of about 15% allotted for healthcare in various states in different countries. And a few other countries have been able to, just a few, about 4 of them since 2001, have been able to meet up to this. And one of them is South Africa, and, they've been able to do justice to this. And recently we have, Governor Bruni from Yobe State, who has strived, for his government, to be able to meet up to this target of 15% allotted budget for the healthcare system. Less than 5%, based on my calculation, is disastrous. If you ask me, it's catastrophic.
Now, let's look at the areas that would be, impacted by this particular shortfall. Now, what specific areas or health initiatives do you believe that will be most affected as a result of the difference? And what are the potential consequences, particularly for the Nigerian population?
Okay, thank you very much. Permit me to start from this perspective. The Nigerian Health Insurance Act, that was Nigerian Health Insurance Authority Act, pardon, that was enacted in May 2022, stated clearly, the act stated with their, manual, that there must be some specific, allocations and some specific demands that should be met by federal government. And an agreement was reached on this. Now we have what we call the vulnerable group. The vulnerable groups part of this budget should have affected, but the budget as it is not even sufficient enough compared to what we had it's just a little improvement compared to what we had in 2022-2023, which was about 4.5 allocated budget for, for health, for the health sector. So for the vulnerable groups, this group of people, which include under 5 children, which include the elderly, this budget should have actually addressed the challenges, the health challenges these people are facing. Amongst many others, the vulnerable, the marginalized, we have the marginalized group as well. Unfortunately, also, the poverty rate in the country, this budget should have affected the people that fall within that, poverty range or group, such as, for example, Nigeria, by going by statistics, by World Poverty Clock, it says about 71 million Nigerians are in poverty. Then the multi-dimensional, poverty rate as well. We have over 133 million Nigerians who are, in that category as well of multidimensional, described as multidimensional poverty. So as you can see, the poverty rate is on the rise, on the increase. The budgetary allocation should have addressed these aspects, but unfortunately, it is not it is not the case in this regard. Quite unfortunate. It's quite low compared to what we have in other countries. Some other African countries are meeting the 15%. Budget has agreed in 2001 by the African Union. But unfortunately, here we are in Nigeria still struggling. Mr. President, President Bola Ahmed Tinubu promised to try to get to about 10 to 12 percent of this budget, to implement that. However, unfortunately, this is not the reality. This is not the case. It's just promises that we keep getting. Quite unfortunate. The government can actually do more.
All right, Dr. Olawale Abodunrin Peters, a medical practitioner and also the Publicity Secretary, NMA Lagos State. Thank you so much for your time.
Thank you for having me.